Hello everyone. My name is Ravi Gadani. I work as a associate professor at Department of Surgery in BJ Medical College, Ahmedabad. And this small session has been devised to introduce the faculties, especially to what are electives in competency-based medical education. So, if we look at the timeline, the syllabus of MBBS underwent a major shift in 2019. So the students who were admitted from 2019 onwards and students who were admitted up to 2018, they had a major difference in the curriculum. We could as well draw a line and say that those who were admitted in 20 up to 2018 were having an old curriculum, and those who were admitted in 2019 and onwards are having something known as new curriculum of MBBS. This new curriculum is also known as CBME or Competency Based Medical Education. Those of us who have undergone revised basic course training in medical education technologies would already know what competency based medical education is. It means that rather than teaching them in a linear fashion, there were certain competencies that were defined, and then learning methods and assessment were devised depending on those competencies in a cyclic manner. So the batch of 2019 was the first batch that was facing this new curriculum or this competency based medical education. This batch of 2019 is yet to finish its MBBS, and that they are going to finish in 2024. So basically, they are right now in their third year and they are about to face the third year first part examination. So somewhere in 2022, the same batch, this is the first batch of CBME will be facing their third year part one examination. If you look at this table which says that MBBS students have first year, then second year, third year, part one, part two, then electives, and we shall talk about them what they are, but electives are sandwiched between third year part one and third year part two. They are for 2 months. So what are electives is what now we are going to see. Those of us who are in clinical terms, and almost all of us who have already been through a medical college, we all know that there is something known as clinical terms. So second year onwards in MBBS, students are posted in clinical terms in medicine and surgery and gynec and pedi and every clinical branch for a specific period. And we call them clinical terms or clinical posting. If you want to really simplify what uh, elective is, then you could say that this is probably a kind of a posting. Okay, to call it, to simplify it, we can begin by calling it a kind of a posting. So why is this posting special? So consider that MBBS students, all of them, are undergoing the same training for 4.5 years. They're undergoing the same training. So all students are expected to be knowing similar things, at the end of their 4.5 years. Electives are an opportunity for the student to have something more than the linear syllabus, the linear curriculum that they are going through in those 4.5 years. Now, before I tell you what an elective is, let me explain it in a different manner. I belong to Department of Surgery. So we have created 2 electives for this MBBS batch. And we believe that in each elective, we will be able to accommodate about 10 students. So now we have 2 electives for 10 students each. So for electives, our department will be able to accommodate 20 students. So we send out these, our details of our electives to the dean office, or the MEU coordinator wherever it goes. Now, considering the same manner, medicine department creates three electives and they are also having 10 students each. So that would make their 30, so to say, 30 seats in electives in medicine and 20 seats in electives in surgery. Now you can just apply the same thing, for example, to all clinical departments, gynecology and pediatrics and psychiatry and dermatology and orthopedists and ophthalmology and ENT in every single department. So when they all come up with electives and the number of students that they can accommodate, you get a grand pool of all the electives that clinical subjects are going to provide. That grand pool would have electives in the range of maybe, I mean, in the range of 30 to 35 maybe. And if they are accommodating about 10 students each, for example, then you have total number of seats in clinical electives of maybe 300 and 350. Now, the way there is a counseling that happens for MBBS seats and then for PG seats, the same way these electives shall be displayed on a board, and then there will be a merit list of the students who are right now in third year part 1 MBBS. Their merit list would be created. There is a specific mechanism how that would be created, which as of now does not concern us, but a merit list would be created. Now consider there is a merit list is created, and the first candidate, someone who scored first, comes forward, and then he is asked that what electives do you wish to take up. Then he says that in block 1 I want this elective in pharmacology, and in block 2 I want this elective in obstetrics and gynecology. Then those two seats, the pharmac department electives 1 seat and gynecology department's 1 seat, goes to that student, and the remaining ones are there. Now the second number student comes and the third number student comes. So that is how it goes on. So it is as if we are distributing those electives to those students, then they all will simultaneously go into the electives. So that means that if I have the students, consider being in surgery, we have created an elective around a basics or introduction to surgical suturing. And if we have 10 students there, then when those 10 students are with us for that clinical elective at the same time, every other department is also having students who chose that particular elective. So electives effectively, if you consider it like a posting, will be for 1 month. The entire batch of that MBBS, like this year it is 2019 batch, all of them are then posted in electives of their choice. So some students are posted with gynecology, some students are posted with pediatrics, some students are posted with surgery, medicine, ortho, so forth, and so on and so forth. Right. So this is one thing. Number one, that electives are to be devised by the department. They are going to be of the topic which can be then included in that particular student's resume. It stands out more than what that student would have linearly learned in case of if he just passed through MBBS. So now you will have a student who would be like I have done my MBBS with my elective in research and my elective in surgical suturing. Somebody may say that I have done my MBBS with my elective in maybe pharmacovigilance and another elective in antenatal care, right? So that is what is going to stand out. These electives are far more relevant if the student chooses to go abroad for further studies, right? Okay, so I think as of now, I am clear around what electives are. Okay, so electives are kind of a posting. They will be for 2 months, out of which 1 month or first month will be for pre and paraclinical subjects. The second month will be for clinical subjects. Each student will pick one from each. So one from pre and paraclinical subjects and one from clinical subjects. Okay. So if we just get back to the presentation again, then the 2019 batch was in the first year and the first year started somewhere in August 2019. 2020 it was the second, first year was continued, and 2022. And 2023 will be entirely third year part 2. And between that third year part 1 and third year part 2 is sandwiched are these two electives. So if you look at the gap between completion of third year, that means the third year final exam is over, the results are yet to come out. The third year final exam is over and the results are yet to come out. And so that is third year final exam is done. And the third year second part actually begins. Between those two is 2 months. And these 2 months are divided into first month and second month. The first month will be known as block 1. The second month will be known as block 2. So the block 1 is when the student will choose an elective of pre and paraclinical branches, and block 2 is for clinical branches. Effectively, they have defined it as a learning experience. Basically, what is it? It's a posting, but it's a learning experience. Fundamentally, it is a learning experience, because if we are offering him one on suturing, we are offering him on antenatal care, we are offering one on speech therapy, whatever we are offering, that student is going to learn that one particular topic slash skill slash concept, everything in a far more intimate way. Second most important thing is it is extremely experiential. So this elective is not about uh, creating more didactics for the student, that he will be attending more lectures of that topic. No, he will be actually involved in the team that is providing care to the patient. He will be actually involved in the team that is conducting a research in a particular department, right? So consider it's a research kind of elective. Then he will first hand come to know what is a research, how to collect data, how to analyze it, what's biostatistics and stuff like that. So he will, at the end of his MBBS, if he has done a elective on research, he will be at a far better place as far as that particular domain is concerned, right? So it's a learning experience which is created in the curriculum to provide an opportunity for the learner to explore, discover, and experience areas or streams of interest, right? It is basically experience the areas or streams of interest. This is very important. It needs to be extremely experiential, kind of a doing kind of a thing rather than just reading or mugging up things. It has to be experiential. The student must feel being a part of the team. So because electives were brought in the curriculum as a new concept, because the old curriculum, that was the students who faced it, who were admitted up to 2018, and students who were admitted 2019 and onwards. So these 2019 and onwards, as I told you, are new curriculum or CBME, and there are some significant differences between old curriculum and new curriculum. There are many others, one of which is electives. And because these electives was a new concept, National Medical Commission also created a module around elective. It's a 30-odd page document. It's a very lucid and simple introduction to what electives are. It also helps us and provides us with a format in which electives can be created. So we are not going to look at the entire document, but some salient features are, if you look at, as I told you, there will be two electives, 2 months, first month, second month, block 1, block 2. Block 1 is pre and paraclinical, block 2 is going to be clinical. So what are the differences? They have compared the block 1 and block 2 electives. So if you see block 1 would be the first month. So before commencement of third part M2, second, third MBBS part 2, sorry, this is also the same. 4 weeks is the duration for each. These will be mainly in the pre and paraclinical, and the block 2 would be in the clinical specialties. Now, if you look at the nature of learning, and this is very important because as I told you that this is going to be extremely experiential in nature, right? It will be supervised. So if we have created in Department of Surgery a elective of suturing, it does not mean that we are going to give him suturing right away. It will be continuously supervised, At the same time, the program will be designed in such a manner that we attain the predefined objectives of that elective. So it has to be experiential and supervised, immersive and self-directed, right? Self-directed learning, it's a major exercise in self-directed learning, and self-directed learning in itself is a huge topic. But to begin with, we can say that it's not going to be like really very linear or didactic. It's going to be more of experiential. The main chief difference between the two is this, that regular clinical postings that begin in the second year onwards will continue during block 1, or will continue when the students have an elective in pre and paraclinical, but they will be suspended when the student is in the clinical electives or block 2. So that means that when, if at all you are in a clinical branch, when the student is coming to you, the student at that time in block 2 does not have any clinical postings, right? They will be suspended. So the design of it is such that during those times the student will not have any clinical postings. Of course, the attendance of 75% is mandatory. The assessment is mainly going to be formative, depending on the kind of elective that you have devised. There is an opportunity to provide out of institute or out of city or state experience. So if you feel that there is a particular institution that is akin, or that aligns with the kind of elective that you have devised for your own department, and you wish to have a posting of that student in that institute, you can do that. But there's a formal procedure that you need to go through, and adequate due approvals needs to be taken. The same module on elective also gives us a template on how to prepare an elective. And this is a template that we all have used, and it's a very simple template. Actually, if you go step by step, you will come to know that this is truly a very simple kind of template, and it allows you to devise your elective effectively. So name of the block, of course, if you are a clinical branch, it will be block 2. If you are pre or paraclinical, it will be block 1. Name of the elective, what you want to name it as. Consider our suturing elective, we have named it as Introduction or Basics of Surgical Suturing. Location, usually these things are, as I told you, unless it is a different institute that you are sending the student to, it will be usually medical college, hospital, right? Usually. Name of the internal preceptor. Now this is important, that we need to assign one faculty as a preceptor for that one elective. Now, if you are accommodating larger strength of the student in a single elective, so consider we have an elective of uh, surgical suturing, and if we are accommodating, maybe we are saying that we are going to take up 20 students. So in that case, we can as well split 10 plus 10 amongst two preceptors, right? So preceptors are basically faculties, but these are not really, they are faculties, but why we don't call them teacher is it's very experiential in nature, and that is why they are known as preceptor. External preceptor comes in play when you have, your elective extends into another institute, as I spoke about earlier. Learning objectives. So those of us who have completed revised basic course, you should be knowing that uh, if it is learning, it's experiential learning, or it's a module, it's a learning experience, then it needs to have three things. First thing is you need to define what are the objectives, where you want to go, right? So that is defining learning objectives. What would the student be able to do at the end of this elective? That is what you define. Second part of the triad is that those learning objectives are going to give you teaching learning method. Now, you do not want to use those classical teaching learning method, and they have been named appropriately as list of activities, which is right here. So first thing is define learning objectives. Second is list of activities. What do you wish to propose to be that will be done during that 1 month, so that you achieve those objectives? So it is like where you want to reach, and how you are going to reach there. Okay. And the third thing is assessment. So assessment is where you decide whether you reached there or not. So any learning activity has these three pillars. First is defining objectives, that gives you the teaching learning method or activities, as in elective it is known as activities, and finally the assessment, right? So learning objectives, you will decide number of students. Depending on the kind of workload that you have, you can define the number of students. You can keep them 5, 7, 8, 10, whichever is appropriate for your particular department. Prerequisites is if you think that there is any pre-existing knowledge that is required by the student before he opts for your own elective. There are some where you want them to have undergone some basic life support training. Sometimes you may think that he needs to have basic understanding of biostatistics. So everything that you feel is required, you can put here. Learning resources, you may provide some learning resources, or you may cite certain textbooks or any other material right here which you are going to provide or guide the student to, so that from where they will be able to learn. List of activities, I told you that this is the way what all they are going to do during that 1 month. Portfolio entries and logbook entries. So portfolio entries required are which all portfolio entries would you want are required for you to say that this student has completed the elective. So consider, uh, and we are going to see a couple of examples as well, that if you think that diabetology is one of the elective that medicine people have selected, and they feel that the student should have presented 2 cases of diabetes during those 1 month. So whether these 2 cases were presented or not, that goes in the logbook. Presented yes or presented no. So and by signed by the preceptor. So that's like whether it was done or not. What was the actual history of that patient and what was the paperwork that the student did? All those, they go in a single file, which is then known as portfolio. So these portfolio entries that you require or the logbook entries that you require is also to be decided by the department, right? Assessment is mainly formative. Now this assessment, you need not take some MCQ kind of thing, because these are very experiential in nature, so you don't want the student to mug up on MCQs, or you don't want to take a written test or anything. But whatever portfolio entries he has done, whatever cases he has presented, whether the attendance was adequate or not, whether he was participating in all the activities or not, whether he was participating in rounds in IPD department or OP department. So all those things you can assess and you can document them. So that is what assessment would be like. Let's look at one example. Consider this is a anatomy department elective that they have created. The name of the block is block 1 because it's a pre and paraclinical department, right? So this is going to be block 1. They have named it as medical genetics. They have written that the place would be medical college hospital because the student will be here only, right? If you see name of the inter preceptor, they can provide the names later on. You can decide about that. External preceptor similarly. Now, as I told you, it was a learning activity. So 3 things: learning objectives, methods, and assessment. So if you look at here, they have devised these learning objectives that they feel that to demonstrate at the end of this elective, the student will be able to demonstrate the conduct of commonly available genetic tests, to enumerate indications for common genetic tests, to enumerate testing protocol for commonly performed genetic tests. So this is what they have decided. Now there are no rules around it, but if you think that if you want to create an elective which is really efficient in 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 achieving its target, like you want the student to have achieved something at the end of that elective, then you know what you think would be required by the student to be able to do at the end of the elective. So those are going to be the elective the objectives. Number of students, they feel that they can accommodate 4 students, so they have kept it as 4. Prerequisites are necessary immunization. They feel that necessary immunization and universal precaution certification are necessary, then they have done that. Learning resources, departmental handbook. The department has created a handbook. You may as well put up the name of any particular textbook or ready-made handbook, some online resources, some videos, whatever. That's all going to be guided by what your elective is and what your objectives are. List of activity. So they're saying, look at this. Work daily with supervisor. participate in departmental educational activities. Now, you can expect them to participate in departmental activities, because what happens is, it, just learning about medical genetics does not only involve like really management of the sample or indication. It also involves the larger picture of identifying the patient. And how is that going to happen? When they participate in departmental activities, right? Present at least two tests which are done by student as a case worker, right? Portfolio entries are documentation of worked up cases, as I told you earlier. And maybe if at all you are expecting the student to present something, then that presentation documentation can also be a portfolio entry. Logbook entry they have defined as completion of the posting signed by preceptor with meets expectation grade. So that if the preceptor is just he's just going to jot it down that I believe that the student has done well and he meets the expectation. If he signs that much, then that is enough of a logbook entry for this particular elective, right? The assessment is usually formative. It is never summative. It is a formative assessment. Attendance is important, whether how he participated, whether he or she was proactive or not, whether they did the cases that were required of them or not, what was the knowledge like. So mainly experiential teaching, and the assessment is also going to be very formative and ongoing in nature. If at all there are any other comments, you can put them here. So this was for block 1. Let's look at one more example of block 2. So name of the block is block 2, which is the clinical block. The elective is diabetology. The location is Medical College Hospital. Names, and now they believe that the learning objectives are to provide care for patients with diabetes in a supervised environment. They believe that he should be able to function as a team member in a multidisciplinary management of diabetes mellitus. They believe that the student will be able to counsel the patient at the end of this elective. So these are the objectives that they have created, right? Number of students they believe are 6. They can easily accommodate, and must have received necessary immunization and BLS training. This is what they feel is required. Now, this depends on electives, so this varies with elective and department. List of activities are participating in OP and IP rounds, participating in afternoon teaching sessions of the department, present at least 2 cases. These are everything that they feel, the department feels that will be done, which will ensure that the objectives are met. Learning resources, as I told you, they believe that this one handbook is the main resource through which the student can gain whatever knowledge he needs to gain and participate in the elective. Portfolio entries, as I told you, are whatever assignments you have given, whatever presentation the student has done. When you document them in a file kind of thing, then that is going to be portfolio entry. And again, they also have mentioned that logbook entry is if the preceptor says that the student meets the expectation and signs it, then that should be enough. Then that is they are committing to it. That if this much is done, then logbook entries are enough. This much is enough as far as the logbook entries are concerned. The same way assessment is formative in nature. Attendance is seen. What was the participation like? What was how much was the student inspired to be on the ward? How was he talking to the patients? What was the zeal of the student to learn? What all cases did he present? What all presentations did he learn? So it's a very formative in nature kind of a assessment. And if at all there are any other comments, you can put them here. These are a few other research related, and you can get this. The module is freely available on the NMC website, so you can clearly get that. With that, I think I end this presentation. I hope that this clarified the doubts that many have in as far as what the electives are and how to really start to implement them, or rather how to create one. Thank you so much for your time. I deeply appreciate it. Thank you. Thank you.